The benefits to families and communities and to children of focusing on health and not just health care is that we will look at other factors. We'll look at housing, we'll look at education, we'll look at childcare quality, we'll look at social cohesion, we'll look at environmental factors, we'll look at all of the things that set a child, a parent, a family up for a successful and healthy life or not. And if you can take care of those things, then what you need health care for is much reduced. The impact on everyone for health disparities and poor health outcomes affects us all. We are all paying when people have no choice but to go to the emergency room for health care to treat things that could have been treated earlier and in a less costly setting. We all pay when there are people who are not productive because they're not healthy. And we all pay when people walk around sick. We learned that during COVID the hard way. But the real change we're looking for is at the policy and system level, because if we don't change the fundamentals, we're just going to be filling gaps. But there's a role for ordinary people who don't necessarily know this and can talk to their legislators. And I think the work that Texans Care and your partners have done to get that message out, we see the advocacy work as really the linchpin of that work, because if there aren't advocates to inform policymakers at the government or institutional level, then who's going to do that? Because if we don't change the fundamentals, we're just going to be filling gaps. And one of the messages that my board gave to me early on was, well, we can try to fill gaps, but wouldn't it be better to close gaps? And policy is the way that you do that. It can be government policy, it can be institutional policy, it can be the policy within your household. And if we can change those parameters, then we have a much bigger opportunity to move forward the lives of the children, the youngest children, who we're trying to help.